Hey everybody, talking a little bit more about non-surgical treatment options for sesamoiditis, sesamoidopathy, or that plantar first metatarsophalangeal joint or big toe joint pain that patients are experiencing. Now, footwear and lacing is so important here, and typically what we're looking at footwear wise is a nice rocker bottom, but making sure that we're not pushing the forces away too much, just taking a little bit of force away from that joint. Another big thing that I like is different lacing techniques, and for this I like the loop lock lacing, which really holds fast onto the ankle, increasing the muscular efficiency of our lower limb and taking a bit of those shear forces away from the forefoot. You could also look at orthoses with different cutouts or modifications to allow that big toe joint to drop down a little bit more, like through a reverse Morton's extension. That's going to really help patients keep that range of motion, but also take some of that force away from that big toe joint. Have a bit of a double check of how the muscular strength's going. There may be concomitant tendinopathies occurring, and so really looking at that Flexor Hallucis Brevis, that Flexor Hallucis Longus, and some of your intrinsic strengthening to try and take away the forces off of the sesamoids and help the foot sort of combat some of that pain, redistributing those peak forces more broadly. For myself, I love photobiomodulation therapy, laser therapies. They're fantastic. They help to reduce the swelling, help to increase the blood flow and therefore the healing rate, and just get people out of pain quickly. And so it's a really good option that we put into place, particularly for these type of concerns that patients respond to really, really rapidly. But in those that are not responding well, that's where you have a few options of looking at offloading with regards to a moon boot with appropriate padding within that to really redistribute the pressure completely away from that first big toe joint. And most people are going to recover pretty well from that, but they're a very avascular area, which means that they don't have much blood flow, and that's going to mean that it is going to take a little bit longer to heal depending on what's happening there. So it could be there for a little while. In some patients that have got chronically fractured or multipartite fractures of the sesamoid, and it's still taking a lot longer to heal, I have been known to put a corticosteroid into that sesamoid, and that's going to almost atrophy the area, reduce that inflammation, but it can dissolve a little bit of that sesamoid over time, particularly if there were multiple injections undertaken. This in some patients can be an okay option, but it's definitely not for everyone. Other things that you can think about are the pharmacological options like your non-steroidal anti-inflammatory drugs, like your paracetamol. But having a bit of a check and seeing, make sure what's most appropriate, because we definitely want to remove the force away from the area so that we can get it healed in the longer term. But for today, that's been non-surgical treatments for sesamoiditis. Hopefully this has given you a few ideas, and I'd love to hear your comments down below of what else you could potentially be putting into place in your clinics too. But for the moment, if you've liked this, hit the subscribe button, check out some of our other videos, and we'll see you there. Cheers.